Good morning, everyone. I'm Roberta Chadis, and welcome to the Memory Cafe with a conversation with Joan Lovely, Senator Joan Lovely. I feel so close to you, Joan. We've met several times, so thank you so very much for coming. And Joan's a close assistant is Michaela. How do you pronounce that last name, Michaela?
It's pronounced like Maloof.
Maloof. I was going to say Maloof, but I guess it's Maloof. So thank you so much, and thank you for your help to coordinate this. And how are you doing today, Joan?
Good. Thank you, Roberta. It's great to be here. I'm so glad that we're doing this morning. I know we've had to cancel a couple of times, but we're here and we've got a lot of great information to exchange. So I'm thrilled to be here. Thank you.
Absolutely. Happy to have you. This is great. Now, I'm just going to start this out with my own little introduction about who I am and why I'm doing this. So about 6 years ago, I actually started my caregiving business with one client because trusting a loved one with a stranger is not easy. It's one of the hardest things that people have to deal with when things happen where people lose their memory and you have to deal with a health issue. So my goal is to help my clients have the best quality life they can. And that's why I am a caregiver. So some of my clients live at home and others are at senior care facilities. And I deal with many different conditions, but some of the more serious ones are Alzheimer's and dementia and even clinical depression, which is really difficult to deal with these days. The services that I provide personally include a little shopping, food shopping, or just getting anything at the CVS. People need things, and now with the pandemic, it's even harder to get them. So going shopping is not an easy chore anymore. I take people to doctor's appointments and I organize their medication. I'm not doing anything medical or nursing, but there's lots of things in the house that need to be done. And having someone like a caregiver, like Lori is a caregiver as well, people really need help. And of course, it's not always easy to ask for it. So, people want to be self-sufficient, but then again, you can't allow that to be making it into an unsafe environment for them. And I've seen that even when I'm caring for people, things go wrong. And it's hard to believe that someone can need and have an emergency when you've looked at every possible aspect of their life and then they're in the hospital. So it's important. And there you go. So I also deal, of course, with the family, and that's a communication chore, which sometimes is good and sometimes it's hard because people are stressed and having to deal with caring for their loved one is like a full-time job. So we have to communicate with the family, with the loved one, and of course with the facility management on many occasions. So as a part of a community project 2 years ago, I launched this Memory Cafe, and that was in June of 2019. I was participating in this educational program, self-improvement with my friend Ruth, and I decided I was going to create a memory cafe, and thanks to Rosanna, there wasn't one in English. There was only one in Spanish. So she said, take it on, and I took it on, and I'm very happy to have been able to help people with this. I'm going to add somebody in right now. I suppose I didn't have to tell you that, but here she comes. Okay. Good morning. How are you? Oh, there's other people. Okay. I'm adding people in. Okay. We have Judith and Dorothy Kersner, my friend and yoga teacher. Nice to see both of you. And everybody is nicely muted. If you feel that there's noise in your own environment, please feel free to mute yourself. So today we are, well, the Memory Cafe, by the way, is designed for people who are living with dementia or Alzheimer's or memory losses or thinking. And it's also designed to help their family members and caregivers. And that's what this Memory Cafe is all about. But today we're going to have a conversation with Senator Joan Lovely. And I'm thrilled to have her on board. And we're going to talk about some critical topics that may give you the answers to the questions that you have. And we're going to cover things like caregivers and caregiving options, resources for seniors and constituents, including COVID testing and vaccination. So hold on to those questions. And Joan has services that she can assist you with. So Senator Lovely is going to talk a little bit about that, as well as the Mass Council on Aging and mental health issues. And at the end, we'll have a Q&A, and we'll have you raise your hand or just yell out, and I'll organize you, I promise. And you can ask all of your questions. I've also put into the chat box several ways to get in touch with Senator Lovely, including her email, her phone number, her website, and I've included the helpline for the Alzheimer's Association, because they offer an incredible amount of assistance. You wouldn't even believe how much they offer, so it's really great. So now I'd just like to tell you a little bit about Senator Lovely, and then we're going to start our program and with our nice conversation. And so here we go. Now, believe it or not, Senator Lovely is in her 5th term in the Massachusetts State Senate. And here's what she does. She represents the 2nd Essex District communities of Beverly, Danvers, Peabody, Salem, and Topsfield. So that is her territory. She serves in leadership as an assistant majority leader, chair of the Joint and Senate Committees on Rules, and as the vice chair of the Senate Committee on Bills in the 3rd reading. I don't know how you do this, honestly. We're not done yet, by the way. Senator Lovely also sits on the Senate Committee on Reimagining Massachusetts, Post-Pandemic Resiliency, the Senate Committee on Global Warming and Climate Change, the Senate Committee on Steering and Policy, and the Joint Committee on Housing. In addition to her committee work, Senator Lovely is the Senate Chair of the Ellen Story Commission on Postpartum Depression, Senate Chair of the Massachusetts Caucus of Women's Legislators, and the Vice Chair of the Public Records Commission. She also chaired the Special Senate Committee to review sexual harassment policies and procedures. Senator Lovely became personally engaged with government when she collaborated with neighbors and volunteers to rebuild a neighborhood playground in Salem, where she subsequently served on the Salem City Council from 1998 to 2012. Okay. And Senator Lovely and her husband, Stephen, make their home in Salem, where I live as well, and they're proud parents of 3 adult children and ecstatic grandparents to a new granddaughter. Congratulations. In her spare time, if you have any spare time, Senator Lovely enjoys boating and gardening. Now, I have met some of your pets, so I know personally that you enjoy your 4 Labrador retrievers. I didn't meet the ducks, but there are 5 ducks, 2 chickens, and 1 cat. And maybe this Topsfield Fair will see you with showing your ducks at the Topsfield Fair. That would be fun. Actually, I see you when I go to the parade at my friend's house in Topsfield. You're always marching down the street, so that's great. Well, I'm now going to turn this Memory Cafe over to Senator Joan Lovely. Take it away. Nice to have you. Thank you so much.
Thank you, Roberta. And I'm so pleased to be here this morning. And good morning, everyone. And thank you for that nice introduction. I could not do all of the work that I do without my amazing staff. And I have Michaela on this morning, who helped organize this event with Roberta. And I have 4 other people that support me in the office, well, remote office for the last year, since the State House is closed. So we are busy. And I'm grateful for all their support and work that they do to really allow us to do this really important work. I'm just going to kind of dive in and tell you first about my personal experience with Alzheimer's. My dad had Alzheimer's. He's been gone since 2006. That was my first year of law school when I lost him that fall. And and he was 80 when he passed away. And he really started to show signs of dementia when he was in his 50s, which concerns myself and my brothers and sisters as we age. Want to make sure that we're staying healthy and so we're always making sure that we're watching for any effects of memory loss and dementia and again Alzheimer's. So I have to tell you, my dad was what we would call pleasantly confused. He was happy. My mom was an incredible caregiver to him. It really took a toll on her, though, as a family caregiver. We did as much as she would let us do. We wanted to have him go to maybe a day program once a week, which we would pay for. She absolutely refused. And when he passed away, she lasted only 2 years, physically caring for him. And at the end, when he forgot who she was, he remembered all us kids right up to the last minute. But he lost her, and that was hurtful to her. But it's the effects of this disease. And she passed away a couple years later. We think from just exhaustion. So Roberta, thank you for what you do, because it is so important. It's so important. And now as we live in the last year in a pandemic, where families have been isolated, where day programs have been shut down, where there's less social interaction and stimulation, where caregivers have had to leave jobs to care for their loved ones, where adult children are struggling and juggling to a care for parents who are isolated at home, who are just been struggling. It's been difficult for everyone. So we have to acknowledge that we're human. We feel stress and fatigue, and something as routine as going to a grocery store now is stressful. And we do see light at the end of the tunnel, though, because we are navigating our way out of this. As more of the population gets vaccinated, I'm waiting for my opportunity to do that. And I think as President Biden, I think, put it this morning, I saw on the news, by Independence Day, July 4th, hoping that most of the American population is vaccinated so that we can get back together as families, because it's been so difficult. So let me stop there. And I think we could probably pop into some Q&A for you and I, Roberta, and I have a question for you.
Sure.
So can you provide some insight on what you've been seeing from a caregiver perspective, and how has the pandemic affected this from your caregiver perspective, since you're doing this work directly?
Sure, of course I can. And let's see, I think I'll just put the gallery back on here. I see confusion. There's a lot of confusion, not only the people that I care for, there. I once went into one of my clients and she was sitting in front of the television all alone wearing a face mask. There was no one in the house. There was no need for it. But you know, when you're older and you're dealing with different issues, she kind of felt like those people on the television were real people. So, you know, here she is sitting with a face mask. She's confused. Why can't I go out? Why can't I have the cleaning people come in? You know, why can't the family visit me? Why and it's, even if you explain it to her the next day, it's like, what's going on here? Why do I have to wear this mask? And it just adds to the situation that is already existing. It's another layer to have to deal with. And of course the family is dealing with the same thing, and it just multiplies and multiplies, just getting supplies, getting people to come to the house. I have another friend who has an older, her husband is dealing with you know, care and going to the hospital, but everybody's afraid of bringing other people into their home to help with the care that's needed. So yes, I took a risk. I ended up with COVID in January, and luckily I dealt with it. My client, you know, my client had to be moved to a different facility, and that was a 2-week upset for her. Thank God she handled the health issues fine, but everything else was just a mess. I mean, you know, between a lost walker, the walker never came back with her, and her meds, you know, it's just, you think it's easy because you can pack a suitcase yourself, but it's not. It's not. And everyone's dealing with the unknown. And of course, we're going to talk about more issues. I'm just trying oh, and the boredom, not being able to have, like at these facilities where they usually have people come in for with music and programs and movies and, you know, days out to go to lunch and visiting other places. None of that is really being done. So there you are as a caregiver. Sometimes you can't go in to visit someone, okay? And there you are as someone who's in a facility and you can't, there's nothing to do. So it's really tough. So I try to entertain and care and listen. Listening is really important. But I don't want to take up this entire memory cafe with all of these issues. Things are getting better. So the weather is getting warmer. We'll be able to go out. The vaccine is here. So I truly believe that things will soften up, and we'll make it. We've all gotten stronger. We're just looking at life differently. So
It's so true. It's
yeah.
so true. So, just kind of following up on that, what are some caregiving options that you could suggest for people who are taking care of a loved one with Alzheimer's?
Well, I obviously these memory cafes, whatever's available, they're all over the world. This isn't just something that we came up with here. And the Alzheimer's Association has many different options and services. You, Senator Lovely, you're going to tell us about what's available here in Massachusetts. And I think that just just doing whatever you can do to get help for your loved one, you know, sometimes things aren't paid for, but they might be worth it right now to just expend a little bit of money to make someone's day less boring and less lonely. So I would say getting company out there if you can, um, socially distant, masked, whatever needs to be done. But even 15 minutes or half an hour with someone can just really brighten up their day. So I would try to do that. Lori probably would agree with that tremendously. And uh, there's a company that does a lot of good work right now. That's Care Dimensions. that is a facility, and they offer a lot of Zoom programs that are very interesting. And there's also some daycare programs that are out there for people, so you can bring someone for part of the day and they'll have something to do. There's a little socialization going on. So it's not easy. It definitely is not easy, but whatever you can do to add a little something to the day, that's it. That would really do it. And to be positive, and not be stressing the negative. You know, saying, well, we can do this, we can do that, instead of we can't go out or we can't be with people. You come up with things. You watch a good movie together. You listen to good music. Go outside and sit in the sun now that it's warmer. So anything like that, as little as it seems, that is really good. And while we're on this topic, I'm going to shift over to you, Senator Lovely, and maybe you can tell us about some of the updates in residential and assisted living facilities. That would be great.
Sure thing, absolutely. As we know, the impact of COVID-19 on our living facilities, residential, nursing homes, you know, it's been terrible. We know how bad it's been, that our seniors are particularly at risk for contracting COVID-19. And, you know, last March when, you know, we shut the economy down, first responders had to go to work and go and take care of this very vulnerable population. And unbeknownst to many, you know, people who are permanently homed in a nursing home or a congregate care facility, they had no access to the outside world except through their caregivers, nurses aides, all the medical caregivers. And, you know, that's how COVID literally walked into many of these facilities, and the toll was devastating. It's been devastating. There wasn't enough PPE back then, if you remember, personal protection equipment. We couldn't get enough masks. We couldn't get enough gowns. So grateful to Bob Kraft for, you know, and the Kraft family for flying a jet to China to pick up a jet full of masks to come back. So all of our first responders have been particularly hard hit, but particularly our seniors. And so now today, we have enough of all of that equipment to be able to make sure people are protected from each other, frankly. And you already said it: distancing, masking, a ton of hand washing. And you know what? Has anybody had a sniffle this winter season? I haven't had one cold. I haven't had the flu. I always get my flu shot. And you know what, Roberta? I actually also had COVID too back in November. And, you know, practicing everything to the letter to make sure that I even keep a bottle of 90%, a spray bottle of 90% alcohol in my car. So if I would go into the grocery store, I'd come out, the first thing I do is spray my hands, wipe the wheel, make sure wipe the seatbelt before I even started my car. And still I got COVID. That just tells you how contagious it is. Thankfully, I did not have a terrible go of it. I had, I would say, an average go. I had symptoms, and I isolated. Thank God I had a spare bedroom to isolate in. You know, there's many families out there that don't have that, and no one else in my family got it. But you know, so today, you know, what did we do? So we've got enough PPE, and back in January we prioritized, you know, that these assisted living facilities, et cetera, nursing homes, congregate care facilities for vaccinations. You know, so all of the frontline caregivers have been vaccinated who want to be vaccinated. All of the residents in these homes have been vaccinated. And, you know, as a result, we're seeing our numbers really coming down as far as people who are getting ill. And the vaccination has a very high success rate. So that's a good thing. We just don't have enough vaccinations. We have right now, the last I looked, which was earlier this week, we have about over 2 million people that are eligible, under the eligibility requirements to be vaccinated. And we get about 150,000 vaccinations a week from the federal government. So people who go get on the phone on Thursday morning at the crack of dawn to try to get an appointment. I heard from a gentleman yesterday who was quite angry. He was like 44,000 in line.
Yeah.
And he still didn't get an appointment. And I said, well, wait till today. Today being Friday, March 12th, is when it opens up that you can actually register and they'll call you with an appointment. So the rollout for the vaccine in Massachusetts has not been good. It's been rocky compared to some other states. It is a supply and demand issue. So we are, as the supply increases, the demand will go down. We'll have more people vaccinated. So, so that's what we did. We prioritized congregate care facilities again to make sure that they have all been vaccinated, because we need to keep people who are in these facilities safe and well, and cared for. So,
Yeah, it's true. My observation of facilities and just buildings like at the Brooksby Village, which isn't real, well, part of it's a facility in some of the buildings. They did an excellent job of getting those vaccines out. And I also have seen other facilities doing the same thing. They've got the date, everybody gets vaccinated and then they get the second shot. I'm getting my second shot tomorrow. Thanks to a friend of mine who said, call now. So I use the CVS.com and managed to get that done. So I'm very happy. But what are the other services that people are asking for from you?
So as you can imagine, we receive, hundreds of emails a day, dozens of phone calls from people who are hurting, relative to particularly to the pandemic. So, for example, the number one call we're getting in the office right now, and I'll tell you the close second, but the number one is for unemployment assistance. We have a lot of people who are out of work, who are unable to access the unemployment system, or they're having to wait weeks and weeks for approval. Now that has to do with the fact that, again, last spring, there was a big scam and fraud that occurred all over the United States by foreign operators who came in and literally were able to access millions of dollars of unemployment benefits under false names, but the right Social Security numbers. They were able to hack people's accounts, and so what did that do? We had to literally just shut the system down and go through everybody. And now there's more safeguards in place. So people are having to wait though as they are cleared through the system. How do you wait if you're living paycheck to paycheck? So I would tell your viewers, call my office. We are able to access unemployment directly to the agency, and we're able to at least get some light on whatever the issue might be for that particular case, and speed up the process. And we hear from people, right? So we are hearing from people. So that's the number one issue. The second one, though, is the vaccines, the vaccine access. Again, the gentleman I mentioned who called yesterday was quite angry. I called him back and I said, I'm so sorry. You're right. The site has some bumps and bruises, but it's getting better. And go on today and sign up. So that will get better. But food insecurity is also an issue. Our food banks and our local food pantries are working 24/7 to be able to get food, good nutritious food out to people. I just toured a facility in Salem down at Shetland Park just a couple of weeks ago, where they are now becoming kind of a central storage area for perishables, fruits and vegetables, but they also have dry goods and then frozen foods for the different pantries. So for the Salem Food Pantry, for Haven from Hunger, in Peabody. So to make sure that, because what happens is, someone from one of these pantries will jump in their van, head to the Greater Boston Food Bank, load up and come back. But that's almost a daily thing. So this facility holds a week's worth of food that then they can get directly out to people. It's really working really well. So food insecurity, rental and housing assistance. As we know, there's an eviction moratorium. It was through the most of last year. But the state has put a lot of funding into rental assistance. So if any of your viewers are struggling with rent payments, contact my office. We can get them in touch with programs in the state that can be able to support people as we again navigate our way out. We work with Harbor Lake Community Partners, who's creating supportive housing. So, we have a housing shortage, which creates again, supply and demand. The supply is low, the demand is high, the prices go crazy. And we're seeing that, right, in our real estate market. Well, right. Harbor Lake Community Partners out of Beverly is creating affordable housing in different communities. Salem, Beverly, they're working on a beautiful facility over in Hamilton and Wenham. And so these are our partners, these are our nonprofit partners that we work with. So, those are kind of the big bucket items, but if anybody's having issues with whatever their issue might be, give our office a call because we can help direct you into the right supports.
That's great. And what about things like transportation and financial aid? Where can they go for that? And I just don't want to forget about seniors who don't have access to computers. And how do they get help?
So that has been particularly challenging. So, for folks that where a computer would be able to, again, gain access to a lot of this information, give us a call. We'll look it up on our computer. We'll connect those dots. But I want to give a big shout out. Rosanna Donahue is on to the Councils on Aging. Yeah. These are our greatest resources. When people are calling our office looking for, something in the senior sector, if you will, we reach right out to our Councils on Aging, whether it's Shine counselors who are going to help with Medicaid or Medicare, whether it's social workers who are going to make sure that, your bills are being paid on time, or what other type of services, Meals on Wheels, transportation, to and from doctor's appointments, grocery shopping. We also lean heavily on elder services of Merrimack Valley and North Shore. That was North Shore Elder Services. They merged with the Merrimack Valley Elder Services. And so Elder Services of Merrimack Valley North Shore, they cover Salem, Peabody, and Danvers. And then we have Senior Care, which is out of Gloucester, and they cover Beverly and Topsfield. So between our COAs, Salem, Beverly, Peabody, Danvers, Topsfield, they all have great councils on aging. And though these two agencies, Senior Care and Elder Services of North Shore, we are rich in resources and help for people. So again, they can call directly to them, call my office, we'll make those connections to whatever, again, supports or what people are looking to get answers to.
That's great. That's great. Oftentimes it's just because people don't know where to go. They don't know who to call.
Exactly.
And things don't get done and you end up with a problem. But let's not end this Memory Cafe without talking about the very prominent things that are going on right now, which is COVID testing and vaccines. Yes. I know you talked a bit about the vaccinations, but a lot of people ask questions like, do I still have to get tested? What should I be doing, basically?
So once someone is vaccinated, The recommendation from the CDC is to, when you're in public, to still wear a mask. You know, I mean, the vaccine isn't 100% against a COVID infection. It's pretty high up there. It's really way better than a flu shot. But still, you still have to be careful if you're out grocery shopping. You know, wear your mask. Make sure you're washing your hands when you get back home. I am hearing that, you know, that those who have been vaccinated are able to gather together without a mask. So, but the thing is with the mask protects me and you, right? So if I'm wearing a mask, I protect you. If you're wearing a mask, you protect me. And not everybody's been vaccinated. So we do want to make sure people are still adhering to these recommendations and strong guidelines. I will tell you, going forward, because I didn't have a sniffle this winter and I didn't get the flu, even though I had the flu shot, every winter I'm going to wear a mask because usually I get one really tough cold where I'm sick for a good couple of weeks, and it's miserable. Who wants to be sick? So you know what? I may be the only one next winter wearing a mask, but you'll recognize me. So people, you know, so they don't need to be tested unless you're unless you're traveling internationally. To get back, you have to be tested to come back into the country. They just lifted it state to state, I believe, the CDC did. But definitely check with if you don't know, call my office. We can get that information, you know. And you know what? But testing is widely available. You know, you mentioned that I've got a new granddaughter. She's 4 months old, and she happens to be living with me, my daughter and her husband, and this new baby. They're building a house, but the house has been delayed because of COVID, and we have an in-law which was empty. So I'm the lucky grandmother that has the baby in the house. But I've been testing weekly to make sure that I didn't bring COVID in, and didn't I get COVID? Just before Thanksgiving, thankfully, again, nobody got. But I've been testing since then, up until I get vaccinated, every week. And so there's stop the spread testing in Salem, right at Salem High School, every evening, drive through, and every day. Sometimes it's morning, sometimes it's afternoon at Old Town Hall. I've been to both facilities. So easy to get in and out. If you want to be tested, you get the results the very next day. And again, if somebody hasn't been vaccinated yet and you're eligible, you mentioned CVS and Walgreens is vaccinating. I know that some doctors' offices are vaccinating, so check with your physician. And then we've got these big mass testing sites like Gillette and the DoubleTree. That can be difficult if you don't have a car, admittedly. And then we do have shut-ins. We have seniors that cannot leave their home. Not just seniors, but people with some significant physical disabilities that they can't leave. So the state is working very hard, again, through our boards of health, to get right to someone's home to vaccinate them.
Yes, and even in my young age group, I felt very young because I wasn't old enough to sign up first. So we're all seeing and hearing people complaining about getting this vaccination, you know, an appointment. Any words of wisdom on that? What should we do, Joan?
So again, as of today, March 12th, you can go, you can sign up online if you have a computer and register. I believe there's also a phone number where you can register. Again, call my office. We can get that information to you so that you're in the system. And what they do is they call you back with an appointment. So you don't have to sit on the phone for hours like people have been doing. Extremely frustrating. You know, what's happening is people are anxious. They're afraid, rightfully so. We want to be vaccinated so that we can get back into our normal routines and not be isolated and, you know, practically, you know, not able to leave our homes. So people, you know, as of today, the system should get better. And We are, again, getting as many vaccines weekly as possible. It's about 150,000 right now, but as Johnson & Johnson has come on, so now we have 3 manufacturers of vaccines. And, so as the system, as they make more vaccines, the system will be flooded with them and we will get everybody vaccinated.
That's great. What I was thinking was, at this point in our meeting, we might want to open up with some questions and answers. What do you think?
That sounds great.
Is that a good idea?
Great idea.
And that way we might be covering some points that we might not have addressed before we close this program. So does everyone know how to use the hand raising function? Is you go over to reactions down at the bottom of your screen, and there's a little bar that says raise hand, or you can just wave at us. There's only a few screens, so I could select you. Lajla, you are using the raise hand function. Go for it.
So easy, so easy. Can you hear me?
Yes.
So thank you, Senator Lovely, for being with us. This has been so informative. And I'm like you, I go for testing in Salem every week. My bubble does. And it's so easy, so easy. And it's been months since we've even stood in line to get a test, which upsets me a little bit because I think that means people aren't testing as much as they used to, even though it's so easy here. Anyway, I think one of the things that I've worried about, maybe a silver lining of the pandemic has been that we've seen a lot of broken systems that we need to fix. And one of those is the people who are on the front lines of giving elder care, especially, are maybe not associated with a hospital, or they're definitely underpaid. They're treated, I feel like the stories suggest they're treated pretty poorly. And of course, then there's high turnover. So I wonder how can we not do that anymore? I mean, how do we elevate those people, those caregivers, to a status where they're better taken care of?
I completely agree. And this is an issue that is actively discussed about in the legislature. I always put it in my budget asks to increase the rates to these caregivers, because what happens is, you'll get a caregiver who will gain great experience doing this work, but it's not sustainable. You can't live on the pay, and then they go off and get a better paying job with the Commonwealth. The Commonwealth pays better than we pay than the rate that we give, which makes no sense at all.
Right.
So you bring up a very important topic and issue that I'm going to continue to pound the sand with my colleagues about. This is something that we just have to do. I mean, we're raising the minimum wage. It'll be $15 an hour in just a couple of years. But that's not a living wage. We recognize. But these are people who are, you're right, are doing really hard and important work, and they're not being adequately compensated. And so I'm going to continue. I have my budget meeting next week where I'll raise this again with Ways and Means and continue to work in this budget to raise those rates.
Can I ask, is there in this American Rescue Bill that President Biden, I love saying that so much, that he just signed yesterday, it is so deep. There's so much help for average people, regular working people. Is there money and are there programs for things like this, or just to give to the states for what you need?
So we're so grateful to the administration and Congress for prioritizing this package that's coming. I just heard yesterday that Massachusetts is going to get the third highest allotment in the country of funding. So absolutely. And that's where we prioritize these dollars, is to increase the rates to reinforce our programming to make sure that we are caring for everybody. So gratefully that's coming, and we will be very involved in how that gets dispersed. So I'm glad you raised that. Very important.
Thank you.
You're welcome.
Thank you, Lajla. Okay, next we have, I see Barb is waving at me, and then I'll get Lori. Barb, oh, there.
Had to unmute. One of my concerns, Senator Lovely, and thank you so much for doing this today, even though I don't live in your district, I do appreciate you giving your time. What I'm seeing in terms of the mental health impact on family caregivers, spouses, and I know several of them who I am extremely concerned about because they are so on the very edge of the cliff. They are emotionally worn out. I've seen these are people that are in our memory cafe and other people I know. Their loved ones' decline has increased noticeably. I was a caregiver for my partner who had Alzheimer's, and I can't even imagine trying to have lived through this with her and her illness. But what worries me is that I don't want to see people forgotten when this is over, because I think, including obviously the first responders, healthcare workers, but I think the level of PTSD is going to be substantial. Yeah. And I don't want to see family caregivers forgotten. And I will say I'm on the Governor's Advisory Council on Alzheimer's, and we are working on caregiver support. But it just worries me to see some what I can recognize as impending mental health issues and possible addiction issues, which is very, very distressing to me. These are people who have given their all to their loved one, and they're running on fumes now. And it's heartbreaking, and all of you, I'm sure are aware of it. And these are people who aren't getting paid anything.
Right.
They're doing it because it's the person they love. So that's all. That's one of my big.
Thank you, Barb. Thanks for raising that. You're absolutely right. And I my own experience with my mom, she passed away in 2009. So I think from sheer exhaustion from caring for my dad. And again, the resources are we've got the Salem Council on Aging right in this meeting with us. And they're great resources. And I would encourage people to reach out. Now, I will tell you again about my mom when I was trying to encourage her to get to the Beverly COA, because, for socialization. And she's like, that's for old people. And I would get so upset. And so I never did get her there. But those are great resources. And, again, if people are looking for information, certainly call my office. We'll connect you in. If they're having any problems with Medicare or Medicaid or whatever they might be on, definitely call our office. We work very closely with Congressman Moulton's office to be able to assist people. And so I want to make sure that people know that we are a strong resource. But again, the COAs are just amazing at what they do. This is exactly what they do. Again, big shout out to Rosanna, who's on this meeting today, because we work very closely with them and to make sure people are supported, especially now, especially with the past year. I just can't imagine this, the stress level, and it like you said, it depletes people. Their own health is at great risk. So yeah, So please, viewers and listeners, please reach out because there is help.
Thank you. Thank you so much. And now Lori. Lori has a question.
Hi, thank you, Senator Lovely. This was really helpful. I'm sorry, I got a call from the doctor about my client as we were in the middle, so I apologize for walking away, but she had blood work yesterday and we were getting results, so I apologize. But I was interested when you said you were part of the Council of for after COVID community work. And I was interested in thinking about what are some of the topics that they're talking about, because much like Barb just said, a lot of non-paid caregiving, which I get paid. I'm lucky. I'm a private caregiver with somebody and I get paid directly, but a lot of people aren't. And I've been part of some caregiving support groups that were immense. I mean, they were so helpful. And I actually just started writing a book about some tools that people could use as such, because when you're giving somebody exercise, you're getting exercise, and those little tools and getting a support system in place is tremendous. And I don't think there's a lot of resources to help unpaid caregivers or families or loved ones. And it's a matter of just educating, like you said, your mom didn't go, educating people that there shouldn't be that discrimination. There shouldn't be those categories and like the cafes and all the other stigmas that we have in our communities. It's educating people in their perception. And I was wondering if you guys are talking about anything like that.
So great question, Lori. Thank you. So we are, and as Roberta had, and you picked up on it from the beginning, a new committee that I've been assigned to it's called Reimagining Massachusetts Post-Pandemic Resiliency, because we're coming out of this after a year, and our world is permanently changed. The way we're going to do business, the way we're going to, see each other. I imagine we'll be in these types of Zoom forums going forward often. And you know what? They're very efficient. I tell you, we can get a lot of people on, whereas, can you imagine if you were coming into Boston today, and so driving in or taking the train and finding parking and then walking up to the State House to a hearing room, and these are efficient. So that is a good thing. But this committee, and we've had one meeting, and we've got a series of public meetings coming up, and I can make that available, Roberta, to you, and I'll make sure the COA has it and everyone in this meeting today, where we're going to be looking at different sectors. So seniors, veterans, business, the tourism industry, healthcare, transportation, you name it. We're going to be talking about it all over the Commonwealth. So we're inviting people in from all over the Commonwealth to come and share their experiences with us and thoughts about coming through this. What's changed? What's a permanent change? What's temporarily changed? And what can we do better to make us resilient should something like this ever happen again? And so I'm really looking forward to the work, and I invite all of you and all the viewers and listeners to participate. We'll make sure we get that information to you, because the information you have directly working as caregivers and with this population is extremely important for this committee to know, and so we can incorporate that right into our final recommendation. So we'll be working on this. This is a permanent committee that will continue, that's new, but it's not a one-time thing. We're going to continue with it probably for years to come, but we're just getting underway with our work. So I welcome all of your thoughts and ideas, experiences on how we can do this better.
That's great. Now, before I close our Memory Cafe Zoom, does anyone have any other question that came up to ask? Because after listening to everyone's questions and everything that you had to say, thank you so very much, Senator Joan Lovely. I hope to see you in person and possibly with your dogs, maybe.
I was going to say, with the dogs, absolutely.
We'll go take a walk. I noticed you've got 4 4 dogs now.
We
I thought it
do.
was 3. You got a new one?
We did. So we have Maddie, who's yellow. She's 11.
Right.
We adopted Ivy, who was 10. Ivy is mother to Charlie, who is 5. Charlie is mother to Pippa, who is almost 1. So that's how we've got grandmother, mother, daughter, and we will breed Pippa when she's ready, when she's about 2.
Oh, that's great. Okay, everybody get ready. You might be able to adopt a dog. Who knows?
Right. That's right.
Anyways, on a positive note, to end this Memory Cafe, I must say this pandemic has given us all a more intense focus on health and on ourselves and how we deal with living at home and changing all of our behaviors. And I really do see a positive result from that, because a lot of us weren't focusing on our health. We weren't really caring about others. So let's continue that. And let's, as Joan is working on this post-pandemic project, I really think that we can use the pandemic in a more positive way. That's basically what I'm trying to say, to stay focused on health and the community and really not ignore some things that just aren't right, and just fix the problems and move on. So what you're doing, Joan, is so valuable. And not only you, but everyone on this screen, I know personally, between Dorothy, who's doing Zoom yoga, and I don't know Judith, but I'm sure Judith is doing something fabulous. I know Ruth is working with the temple, and Barb is working with the memory cafes, and God knows, Rosanna, you're probably not even sleeping. You're doing so much with the Council on Aging in Salem. Michaela is helping Joan in so many different ways. And Lori's my neighbor. I know how hard she works. And Lajla, you're out there doing your thing and helping people with their businesses and creative needs. And everybody's doing something. So send that out, send it out to the rest of the community and just enhance this positivity. Yes, Ruth.
Well, before you sign off, Roberta,
Yes.
I want to just acknowledge you. You've been doing these memory cafes for 2 years now. And I remember when you first came up with this and you were scared, but you were going to do it. And I know that this is your last one. So on behalf of everybody, I just want to thank you.
Thank you, Roberta.
For your work over the last 2 years on behalf of people
Blushing.
with Alzheimer's and dementia. And you were so passionate about this and so excited to make a difference, and you really have. So I just want to make sure that we all thank you.
Well, thank you.
Thank you, Roberta.
Thank you, Birdie.
Thank
You're
you.
you're wonderful, Roberta.
Thanks, Roberta.
Thank you, Roberta.
Wonderful
Thank you.
things.
Thank you for setting this up also. This was wonderful.
I'm
And
so
thank you for
glad.
coming, Joan.
I may surprise you down the line. I do enjoy doing this, and I enjoy.
I don't believe this is the last one. There's more to come.
It's never the last. We'll have a
You've been
comeback.
doing
You need a-
wonderful work.
Yeah.
I
You
know
need a
that.
primetime special, Birdie.
I do. Maybe a Netflix special. What
Yes,
do you think?
yes, fantastic.
All right. So
All right.
where are you
Thank
off
you.
to now, Joan? Where are you going?
Michaela and I have about a half an hour, and then we're going to pop into a next meeting. We're actually meeting with some legislators from Northern Ireland.
Wow.
Ah.
Yeah, in about noontime, I think, so about an hour. And so the Mass Legislature and the Northern Ireland Assembly, I think they're called, are going to meet, and we're going to hear from one assemblyman about Brexit and how
Oh,
that's
great.
impacting Northern Ireland. Yes, so we're going international this afternoon.
Excellent. And
Wow,
just
that'll be meaty.
Yeah.
That's great. Well, I am about to end the recording, but we want to make it look good. So I'm just going to thank everyone for coming. Thank you, Senator Joan Lovely and Michaela Maloof. You made this so easy. And thank you all for coming. Yes, I might be back. But
Thank you, Senator.
just stay healthy, wear your mask, and be kind to everyone around you because it really makes a difference.
Awesome. Thank you.
Thank you.
Bye.
Thank you, everybody.